Hello, my name's Jenny Kay and I'm a senior nurse for older people and dementia at University Hospitals of Leicester. I would like to share with you the work we have done to improve fall safety for patients. Falls are the most frequently reported safety incident in NHS hospitals, and although most falls aren't preventable, neither should they be seen as inevitable. In 2018-19, there were an average of 230 adult falls reported each month in the Trust, and this had been slowly increasing each year. We needed to take action. So what did we want to do? Well, firstly, we wanted the patients to be safe. We wanted to understand both the patient and the staff's views and thoughts on why falls happen. We wanted to increase our falls prevention care and strengthen our risk assessment to ensure that these were both multifactorial and patient-centred. And together, all of this became our stand-up mnemonic. We started in January 2019 by undertaking an extensive review of all of our falls data and the themes gathered through validation. This gave us our baseline and the starting point to develop a new approach to falls prevention in the Trust. The Falls Safety Initiative included new enhanced falls reduction measures, stand-up, a new falls screening tool to identify patients requiring standard or enhanced falls reduction measures, and a 5-step approach to improve falls safety. The poster on the right came out of our brainstorming session. Remember, we are nurses and not artists. The stand were the new enhanced measures we wanted staff to implement. We then added up for them to continue doing what they already had been doing. The poster and the new risk assessment and the new care plan were piloted in 5 clinical areas. Each area was visited daily and the facilitators engaged with staff to support the implementation. The new risk assessment clearly identified those patients who needed enhanced falls reduction measures. Feedback from staff was collected throughout the pilot. They told us they liked the new screening questions, but felt the documentation was repetitive, as at that time they recorded things elsewhere, that not all patients were suitable to be involved in the exercises, and that falls needed a multidisciplinary team approach and not just a nursing approach. All of the staff told us the project had increased their awareness of falls safety. A simple questionnaire was devised to collect feedback from patients who had sustained an inpatient fall. 88 patients across the Trust were asked to provide feedback, and 56 patients agreed to be interviewed and complete a questionnaire. The patients' frailty scores ranged between 3 and 7. 28 of the patients had been admitted following a fall, and 52 patients had had 2 or more falls in the previous 12 months. It quickly became apparent that patients did not identify with the term fall. They slipped, tumbled, rolled and tripped, but my personal favourite was the lady who told us she danced to the floor. Patients told us they felt supported by the ward staff following their fall, and most patients felt that the fall had affected their confidence. Only 6 patients had received falls prevention advice from staff, but they had found this useful, and no patients had been provided with our falls information leaflet. The results of the pilot, along with the feedback from patients and staff, were shared with the Falls Management Steering Group, and the work was approved for implementation across the Trust. The graphics team transformed the stand-up poster, which is the backbone of enhanced falls reduction measures. The new care plan was multifactorial and supports standard and enhanced falls reduction measures. The risk assessment was originally combined with the care plan, but we have refined this further now, and it is included on our electronic nerve centre system. Falls per 1,000 occupied bed days are a nationally recognised way of reporting falls. Plotting the data in an SPC highlighted a statistical significant change in our falls rates following the introduction of enhanced reduction measures. We achieved a significant reduction in our falls rate, observing 7 points below the average. This led to a recalculation of the average and the Trust setting a new lower threshold for falls per 1,000 occupied bed days. A simple 5-step approach to falls safety was developed and supported through on-ward training. Key elements of the 5 steps were to reduce risk to patients and improve communication. Our aim was for every nurse on every ward to be aware of which patients were on enhanced falls reduction measures and if any patients had sustained an inpatient fall. Stand Up made staff rethink and refresh their approach to falls. Staff are being creative in how they communicate the falls risks of patients to maintain their safety. They are using symbols at the bedside and on patient status boards and communicating at handover and at the ward safety huddles. Patients with a history of falls are being recognised as likely to fall again and individualised supportive measures are being put in place earlier. Training sessions to ensure staff have the knowledge and confidence to implement falls safety initiative and Stand Up were delivered across the Trust. This scenario-based training expanded into a comprehensive induction programme for new staff and has been developed into a new e-learning package that is essential to roll for key staff groups. A recognisable brand for falls has been created, ensuring the same imagery is used in posters, training slides and future work. A new falls link role has been established and 87% of adult inpatient areas now have a falls link role to support the falls safety initiative. Our internal web pages for falls have been redesigned in the falls branding and contain all the information on the falls safety initiative, as well as our falls safety bulletins, which are based on learning from falls where a patient has sustained a level 3 or above harm. In September 2020, we held our first Falls Safety Awareness Week. This was mainly a virtual event and competitions were held for the best Falls Safety Awareness Board. Social media was used to share key falls safety messages and videos were produced to promote the importance of lying and standing blood pressure in falls prevention and for exercises for patients to promote muscle strength and minimise deconditioning. Falls safety is a Trust priority to minimise the risk of harm for patients. The heads of nursing have supported the development of a new falls care review and learning process. This ensures falls are reviewed by the ward sister and matron within 24 hours. The new review process crucially centres on the experience of the patient and understanding what they were doing at the time of the fall. The fall can be discussed with the staff involved in the patient's care and all of the relevant documentation can be reviewed. Learning is identified and shared with the clinical teams at each of the safety huddles over the next 7 days. And additional enhanced falls reduction measures can be put in place to minimise the risk of further falls and harm to the patient. As falls safety is not only the remit of nursing teams, a consultant geriatrician worked with us to develop a new falls pathway to support and involve the wider multidisciplinary team in the falls safety initiative. There has been lots of learning through the Falls Safety Initiative work, but key to this was engaging with patients at the outset. This helped change the conversation about falls with patients and would not have happened had we not invested the time and spoken with so many at the beginning of the project. Change is not always easily visible to staff, but this doesn't mean it isn't having an impact. Some things just take a little more time to be noticed. Our 1,000 occupied bed days data evidenced that this work had a positive impact on the number of patients falling in hospital. Projects often come with unexpected benefits. The Falls Safety Initiative has galvanised and reignited the conversation about falls in the Trust. It has created a proactive tool for staff to engage with. They are being creative in individualising falls prevention for patients to maintain their safety. The care review and learning process puts the patient's experience of the incident at the centre of the review, and this would not have been possible without the success of the multifactorial risk assessment and care plan, stand-up and the 5 steps full safety approach. Thank you. I cannot join you today, but my colleague Lorna is available to answer any questions.